Good morning and welcome to the show. I'm your host, Andrea Williams. For the last few weeks, our focus has been on COVID-19, also referred to as the coronavirus. And we've had the opportunity to speak with a number of community leaders and doctors to get different perspectives on COVID-19, how it's affecting our everyday lives, and how we can continue to move forward. Well, today it is a pleasure to be joined by Dr. Jeanette Kowalik, who serves as the Commissioner of Health for the Milwaukee Health Department. How are you, Dr. Kowalik?
Oh, I'm getting by. Thanks for asking. How about you?
I'm doing well, and I know it's to say that you're busy and that these are stressful times is putting it lightly. So thank you so much for your time today. Quickly, we want to be able to get the latest when it comes to the city of Milwaukee and where we are in getting past this pandemic.
As of this morning, today, the 22nd of April, there's about 2,300 cases in the county of Milwaukee, and about 1,700 of those cases are from the city of Milwaukee. Overall, there's about 138 deaths right now. So just looking at the distribution of those, we continue to see that the majority of our cases are African American or Black. And then we have an unknown category, which is about 17% of cases. Unknown race and ethnicity is something that we're working to address because we want to better understand what's really happening in our county and our city. As far as white, that's about 20% of the cases, and then Latinx or Hispanic is about 17% of the cases. So we have been seeing an increase in our Spanish-speaking population, so we are working with a number of community partners related to outreach and increasing testing opportunities on the south side of Milwaukee.
All right, thank you for that. And we will talk more about that outreach, but you did mention that, of course, Milwaukee's African American community has been hit especially hard. We've talked about that every week, and it's made national headlines, needless to say. But Governor Tony Evers actually called it a crisis within a crisis. And you've pointed out that this highlights the disparities between Black and white in this city. So talk a little bit about that.
Right. So the county and the city of Milwaukee declared racism as a public health issue last year. So that was pretty historic for us because, you know, to acknowledge a problem, to formally acknowledge that you have a problem is a big step. That's also a way for us to start working on solutions such as dismantling racist policies and practices that continue to impact the health status of our community. So we see time and time again, whether it's chronic illnesses or other health-related situations like infant mortality, for instance, childhood lead poisoning, which is when I was last on the show, we talked about lead.
Yeah, absolutely.
Yes, also obesity and violence prevention are just some of the examples of health-related topics where we see very stark disparities related to race and ethnicity in the city of Milwaukee. And most of those we see the greatest disparity between Black and white or African American and white. When you trace some of these distributions of health problems back to the back in the days, to when many of our ancestors have relocated to the area, you see these like redlining maps, and you see very similar distributions even playing out today in the health outcomes. Wow. So you see these impacts still playing out, and it's very disturbing, but we have to be able to address all members of our community that are continuing to suffer by these decisions that were made many years ago.
Yeah, and when you were first on the show, I think you had just taken on your position, and I guess none of us would have been able to predict that you'd have something like this on your plate, but you did say that you wanted to erase a racial disparity. So how do we begin to go about doing that, especially since this pandemic has really shined a light on how things have been here for many years that maybe people weren't able to digest until now?
Well, definitely acknowledging that there's a problem, as I noted, but then being willing to do something about it. And we know that oftentimes, like, the root of racism is connected to economy, to money. So if you start making adjustments and creating more fairness and more opportunity, that there's a perception that takes away from others being able to do so. And we strongly advocate against that perspective. We're looking at it like this. When you are a member of a group that has been historically disadvantaged, that you, by making things fair, that's not good enough. You have to actually do more than that to correct for the years of lost equity in money terms, resources, interest rates, based off of where people live and things like that. I mean, there's a lot of economic adjustments that can be made to really help make things better, but there needs to be some intentionality and goodwill from the business community and government at large to really work on creating some opportunity that was lost or not afforded to many members of our community by the color of their skin. So, being in public health, oftentimes we just talk about like disease or prevention of disease, but being able to talk about money and economics and opportunity and being able to like buy your own house or not have to work 3 jobs to make ends meet, that you can actually have one good paying job and that you can actually have a better work-life balance and spend time with your family and maybe work on self-actualizing, whatever it is that you desire to do. So we see how all of these things are connected to health. So being able to talk about that is very important as a health commissioner, that I'm not just referring to, let's talk about immunizations or something like that. It's important, but it's a sliver. We need to talk about the whole picture.
Poverty truly is the root of a lot of things that we see take place. So let's talk about this, because I think a lot of people a couple of weeks ago were disturbed, and they're still disturbed. And now we're getting these reports that 7 cases of the coronavirus have been linked to the elections. So you've got that 7 people, I'm guessing within Milwaukee County, or is that the city of Milwaukee?
City of Milwaukee. So what we've done is, one, the day after the election, the state added a field to their disease surveillance system. It's called WEDS, Wisconsin Electronic Disease Surveillance System. But they added a field for election activities. So either did you vote in person, or did you work at a polling site? And if so, when and where? Like, because remember, this is statewide, not just.
Right. And there's 19 people statewide, right?
Right. Okay. So we saw that update as well. We know that the incubation period for COVID-19 is 14 days. So if the in-person election was on the 7th of April, we should now start seeing some connections between any election activities that happened on the 7th and now. There's a lag in reporting, like say if someone was exposed by going to the polls, we also have to look at what other activities were they involved with. Were they still going out? Were they working? Was someone in their household still going out and possibly being exposed? So there's like an investigation that we conduct as a health department to look at all of the other factors that may have come into play as to how someone contracted COVID-19. The other thing, though, is like looking at cases and how they're connected. So if we're seeing like a cluster of people that were at a certain polling site and we're able to make a connection there and their symptoms and all of that start to manifest around the same time, then we can, through contact tracing and investigation, get a better sense of what's happening. So the data that was reported is very preliminary. There's still more that's happening. So we plan to have the full update, the full report on any election associated infection by next Friday, which is May 1st, because that'll give us more time to do more investigation of all of the possible infections that came out of any election activities. So we anticipate on seeing more, but of course there are some people that don't necessarily understand or acknowledge the role of science and public health in these things, and they're like, oh, that's speculation, or that's whatever. But just as a public health professional, there's a lot of work that goes into these investigations, a lot of time, tracking people down, figuring out all their movements, and you start seeing connections, and that's how you are able to make investigation a connection. So it's like a lot of science and a lot of calculations and so on and so forth, where you see a bigger picture of what really happened. So more to come on that.
All right. Well, thank you for sharing that with us. And I'm also interested in talking about this situation where Governor Evers' safer at home order has been challenged, not only by Republican lawmakers in Madison, but people in the suburbs are protesting. And basically, I think the underlying statements were, that's another zip code. It's not us. So why can't we go back to work? But how did you feel seeing the images of people really being in large crowds, everyone not wearing masks, kind of shoulder to shoulder in some instances, as a health professional who has been pretty much begging people to stay home? What goes through your mind?
So honestly, I have some mixed feelings about that. I understand people's rights and liberties and all of that. But when we're dealing with a virus, a novel virus, the virus does not care about your freedoms. At the end of the day, it will infect any host, which means a human being, possibly other animals. But the concern is the only tool that we have now to prevent the spread is the physical distancing and these types of isolation and quarantine orders that are in effect. I mean, this is a last resort. When is the last time we've seen something like this happen in anybody that we know's lifetime? In 1918. And even looking at history, like some of the protests that happened back in those days of people that were like not wanting to wear masks and doing things. And then they saw this second wave of disease related to influenza or the Spanish flu because of stupidity and ignorance. So we should be looking from a point of, okay, what can we learn from the past and not repeat the same mistakes? We have technology now. Can you imagine being in this position without having Wi-Fi and laptops?
No, we would all be shut down. That's obvious, Yeah, it's crazy to even think about. And I wanted to kind of talk about the fact that the Milwaukee Health Department is going to soon be focusing, if you haven't already started, on long-term care facilities, testing there, as well as House of Corrections, a rescue mission, because we are seeing a large percentage of nursing home residents and staff being infected as well.
Well, and this is the reason why these protests are so foolish, to be quite honest, because congregation is how the disease is really spread. It accelerates. It's like, lighting a match in a dry wilderness. It's just going to infect many, many people. So we see this in any like closed off area. You get one person that's a case, you see how quickly it'll spread throughout that environment, whether it's a jail, whether it's a long-term care facility, an apartment building, a school, any facility where there's a number of people that are closely congregating or residing together is a problem. Mm-hmm. So being able to get in and help to like isolate those that are infected and then those that aren't, and making sure that there's no commingling is really, really important, but definitely stepping up the hygiene and cleaning practices, because this virus is very tiny. And all it takes is one little virus particle to infect other people. So making sure that the enhanced cleaning, thankfully it's droplet, spread by droplet and not necessarily airborne, because there's questions about what about the AC and the heating systems? It's not airborne, so we don't have to worry about that. But just, if you touch your mouth, you touch your eyes, your nose, and then you happen to be a carrier, you might not have symptoms. You could be asymptomatic and you touch something else and someone touches it, you're it. So it can spread that quickly, which is why, the recommendation now is to wear a face covering or mask and to contain it if you happen to be infected, but also to like train you not to touch your face. Mm-hmm. So that's another reason why the mask and face covering recommendation is important. We know everybody doesn't have access to that, so using a shirt or bandana or something, but definitely washing it after each use is really important. But I just wanted to highlight what your question was about, the long-term care facilities. So those are licensed by the state. So the state has regional offices all throughout the state. So the one for Milwaukee is located downtown here, and they're responsible for making sure that long-term care facilities are, sticking to the regulations. So we have been fielding a number of complaints from family members and staff about management of long-term care facilities during this COVID-19 situation. So, we have been like, okay, what can we do to help as far as, if there's additional supplies and support that's needed in these instances. Some of the facilities have been really, really good where they are actually testing all of their staff on site. But then there's others that, are not necessarily as progressive. So, you look at the ones that are really able to do that extra level of testing and isolation and cleaning and all of that as models for those that aren't able to do it. So again, we're all doing our best, and, just whatever information we continue to receive about long-term care facilities that are struggling, that we do take that to heart, and we do share that information with the state, and they have been very responsive.
Thank you. And I'm going to wrap things up with this question because I think it's important. As far as testing, what is the procedure for someone who thinks that they may be experiencing symptoms? What would you say that they should do, and what follows that after that initial test?
Yes, so I'm glad you asked that question because there have been so many updates since we got our first case. Our first case in Milwaukee City and County was on Friday the 13th of last month, so the month of March. And at that time, the state had issued guidance on testing, which really I wouldn't say triage, but really try to make sure that ration was the best word, that people that needed to be tested were getting tested. So those that are most at risk for complications or death, people over the age of 60, people that have underlying health conditions, people that were hospitalized, eventually healthcare workers were added to that, first responders, people that are incarcerated, people that are residents or staff of long-term care facilities. So over time, the state has updated the testing guidelines to include more people. But now the testing guidelines as of last week are anybody with symptoms should get tested. So clinical providers need to understand that if you have outdated guidelines that you're saying you can only test people that are in the hospital, that's out the window. The new guidance is if you have symptoms, you need to get a test, but you first have to get screened. The symptoms are basically flu-like. So body aches, sore throat, respiratory issues, cough. There's also a fever, chills. There's also some new ones related to loss of taste and smell. And then also like GI, like stomach issues, nausea, vomiting, diarrhea have been added to that as well. But if you have any of those symptoms and you have been out and about, maybe you're an essential worker, you still have to go out, or maybe someone in your household's essential and they're going in and out of the house, or you yourself, aren't able to just stay at home, you should probably get tested if you have any of those symptoms. Definitely if you have your own provider, your own healthcare provider or doctor, call first because they'll tell you where to go to get tested. So don't just show up. If you don't have your own doctor, we're recommending going to one of the federally qualified health centers or community health centers. For instance, Milwaukee Health Services, Outreach Community Health, Progressive, 16th Street Community Center, Gerald Ignace. So those are the ones in our area. So getting set up and establishing care there, or calling urgent care. Urgent care is great if you don't have insurance. It's much cheaper than going to an emergency department, which we do not recommend unless you are like literally in a life-threatening situation. You can't breathe, you're dizzy, you're losing feeling in your feet and hands type of thing. Lastly, if you have any of, you get tested and you go get tested, once the results come back, then the health department where you live is responsible for reaching out to you. So if you live in the city of Milwaukee, the Milwaukee Health Department will contact you once those positive test results come into the system. And then they'll do that case investigation, find out where all you've been, and then the contact tracing, which is who all has been exposed to you in that window of time. So we just ask for cooperation on those because we have been having some challenges with people that aren't returning the phone calls. We tend to call private So you know how that is. People are like, oh, you private, I'm gonna answer the phone.
Right.
It could be the health department, so please answer the phone. And then just again, trying to, if you're exposed, like knowing how the incubation period works is 14 days, you know, removing yourself from other people. If you start developing symptoms and you're a contact, definitely getting tested and moving on from there. But there's going to be expanded testing in our community. Different healthcare partners are ramping up more testing opportunities because we just have to get a handle on this right now. I mean, this is life or death at this point.
Absolutely. Thank you so much for all of the outstanding information you have given us today. Dr. Jeanette Kowalik is the Commissioner of Health for the Milwaukee Health Department. If you have questions about COVID-19, you can visit the website milwaukee.gov or dial 211. And again, we thank you. Stay well.
Thank you. You too.
Yes, we're going to take a quick break, and when we return to Our Issues Milwaukee, we'll discuss the steps that are being taken to increase COVID-19 testing across the state. We'll be joined by Dr. Tito Izzard from Milwaukee Health Services Incorporated right after this.